Let's begin with an overview of koilocytes and HPV. Koilocytes are atypical squamous epithelial cells that are most associated with human papillomavirus HPV infection. Human papillomavirus or HPV is a member of the Papillomaviridae family. It's a non-enveloped virus with a double-stranded DNA structure and has an icosahedral shape. HPV infects squamous epithelial cells, which are found in the skin, genital area, mouth, and throat. HPV has two types, which are high risk and low risk, based on their potential to cause cancer. Low risk HPV examples include HPV 6 and 11. These are non-invasive, they stay confined to the surface layer epithelium and do not spread deeper. These types do not cause cancer but can cause benign tumors such as genital warts and mild cervical changes, CIN1, also known as low SIL. High-risk HPV examples include HPV 16 and 18. These types are considered invasive, which means the infection can penetrate deeper beyond the epithelium into the underlying tissues. High-risk HPV produces two dangerous viral proteins, E6 and E7. E6 deactivates the tumor suppressor protein P53 and E7 inactivates RB, retinoblastoma protein, another tumor suppressor. This leads to uncontrolled cell growth and over time can result in cervical cancer.
So now, let's talk about the molecular mechanisms of koilocyte formations in HPV infection. The mechanism involves several stages of infections. At the early stage of infection, it involves HPV infect basal epithelial cells of cervix through microabrasions and takes over host cell machinery. Note that the basal layer of the stratified squamous epithelium contains stem-like cells that are constantly dividing to renew the tissue. Then, the HPV will produce two types of early oncoprotein, which is E6 and E7. E6 will bind to the P53 with the help of host protein called E6AP. Now, imagine P53, it's like a police in our body. It will stop DNA from damage. If the DNA is damaged, it will prevent it from keep dividing or may initiate apoptosis to the cell. E6 will text P53 with ubiquitin and send it to the proteasome, which is a cell shredder. Eventually, the P53 will be inflamed and cell will keep dividing with the damaged DNA. Next is E7, which will inactivate PRB by binding to it. Imagine PRB as a guard. It will stop E2F from initiating DNA replication. E2F is like a printer, which makes a copy of DNA to be replicated, but only when it is right. Now, the PRB will no longer hold back E2F. E2F becomes activate and promotes further DNA replications even when it is not right, which eventually leading to uncontrolled cell divisions and impaired maturations. For the next stage of infections, as the E6 cause loss of cell cycle arrest and apoptosis control, and E7 which causes unregulated entry into S phase promoting abnormal proliferations, the infected basal cell will further progress with process of differentiations and maturations. Eventually, it will lead to the changes in gene expression and cellular morphology, which can be seen as enlarged nucleus, hyperchromatic, irregular nuclear membrane. Then, infected cell will spread towards the upper layer of the epithelium and produce viral protein.
After HPV infects basal cell, the infected cell starts to move upward from the basal layer through the intermediate and eventually into the superficial layer. At this point, viral proteins like E6 and E7 are already active and damaging the nucleus, making it large, dark, and irregular. Now, once the infected cell reach the upper layers, the virus starts producing a different protein, which is E4. E4 acts in the late stage, specifically in intermediate and superficial epithelial cells. The E4 protein will begin to damage the cell structure. It breaks down cytoskeleton, specifically keratin filament. The keratin networks normally keep the cells flat and firm, but once it breaks down, this causes the cell to lose its structure, making it soft, rounded, and easily deformed. Next, it disrupts Golgi apparatus. The Golgi is like the post office of the cell. It packs and sends out protein. If it is disrupted by E4, proteins and vesicles get stuck inside the cell, especially near the nucleus. This leads to swelling and congestion in the perinuclear area. It also causes fluid and protein accumulation. Because of the disrupted Golgi and broken cytoskeleton, the cell cannot move materials properly. This causes protein and fluid accumulation around the nucleus, creating a clear and shiny empty space called the perinuclear halo. It also weakens internal support system. The breakdown of internal filament and organelle destruction makes the cells fragile and less resistant to pressure, contributing to the abnormal, distorted appearance of koilocytes. E4 also facilitates the virus release. This is a final move by the virus. By weakening the cell's internal structure, E4 makes it easier for HPV particles to exit the cells, so it can spread and infect nearby cells. And all of these changes, nuclear damage from E6 and E7, and cytoplasmic destruction from E4, combine to form what we see under the microscope, a koilocyte. In conclusion, HPV infects the basal cell, E6 and E7 damage the nucleus in the early stage, then E4 takes over in the late stage, breaking the inside structure, causing fluid buildup and helping the virus escape. And all that creates the koilocyte and tell us HPV is there.
About the cytological features of koilocyte. Koilocytes are important cells that help us to identify HPV infection. First, koilocytes have a distinctive feature called as a perinuclear halo. This is a clear space around the nucleus caused by the vacuoles in the cytoplasm. These features together help the pathologist to diagnose HPV-related changes. First, let's focus on a nucleus. In koilocytes, the nucleus is enlarged about 2 to 3 times bigger than normal. This enlargement is caused by the uncontrolled DNA replication. Second, there may be binucleation. Sometimes, there are 2 nuclei in one cell. This happens because HPV disrupts normal cell division, cause the cell to fail to split properly. Third, the nucleus also shows hyperchromasia, meaning it appears darker due to increased DNA and showing abnormal activity caused by the virus. And the next, nucleus membrane is irregular or uneven because HPV affects how the cell divides and interfering with mitosis regulation. Finally, the nucleus is often off-center, which is linked to the clear space or halo. So, all these changes help us to identify HPV-infected cells. Now, this slide highlights differences between koilocytes and perinuclear halo. First, for the definition, koilocyte is a special type of squamous epithelial cell that are altered by the HPV infection, while the perinuclear halo is a cytoplasmic feature seen in koilocytes and sometimes in other cells. Second, for the structure involved, in koilocytes, cells are involved from whole cells including structural changes and triggered by viral infection, while in perinuclear halo, there are just specific area of cytoplasmic clearing that forms a clear ring surrounding the nucleus and triggered by the cellular stress, and the lastly is clinical significance. Koilocytes can help us to diagnose of HPV infection, loosely identify, or early dysplasia in Pap smear, while perinuclear halo is one of the key features of koilocytes but not specific to HPV.
I will continue with the clinical significance of koilocyte. First, koilocytes are a sign of HPV infection. So, When koilocytes are seen, it tells us that the person may have been infected with HPV. Next, koilocytes are usually found in locile. This is an early stage of precancerous changes in the cervix. Koilocytes also help guide screening and diagnosis. When they are found, doctors can decide what to do next. For example, whether to repeat the pap smear, test for HPV, or do a colposcopy. So, koilocytes help catch problems early before they turn into cancer. Lastly, koilocytes reminds us why prevention is important. Getting the HPV vaccine, practicing safe sex, and going for regular pap tests can help reduce the risk of HPV infection and lower the chance of seeing koilocytes or developing cervical cancer. Now let's look at the risk factor or things that increase the chance of getting an HPV infection and developing koilocytes. First, having multiple sexual partners increases the chance of being exposed to HPV. Second, unprotected sex also increases risk since HPV spread through skin-to-skin contact. Third, a weakened immune system like in HIV patients makes it harder for the body to fight off HPV. Next, a person that not getting the HPV vaccine means the body is not protected from the virus, especially the high-risk types. Lastly, smoking. Smoking damages the cell in the cervix with their toxic chemical that concentrate in cervical mucus and weakens the local immune response, allowing HPV to stay longer.
Route of transmission. The main route is through sexual contact. HPV can be transmitted during vaginal, anal, or oral sex with an infected partner. Even if the person has no symptoms, the virus can still be passed on. The second route is through skin-to-skin contact, especially when touching the genital area. HPV does not require penetration to spread. Any close skin contact in the genital region can transmit the virus. The last route is called vertical transmission, where the virus is passed from the mother to the fetus during normal childbirth. This happens when the baby is exposed to the maternal genital mucosa infected with HPV. These are the main ways HPV infection can occur, which can later lead to cytological changes such as koilocyte formation. Prevention. To prevent HPV infection and reduce the risk of developing koilocyte-related changes, there are three main strategies. The first is through HPV vaccination. There are two main vaccines, which is Gardasil and Cervarix. Gardasil protects against HPV type 6, 11, 16, and 18, while Cervarix focuses only on high-risk type of 16 and 18. In Malaysia, the Gardasil vaccine is provided free of charge to female students at the age of 13 as part of the National HPV Vaccination Program. The second prevention method is through safer sex education and practice. This includes limiting the number of sexual partners and ideally having only one sexual partner, which is known as monogamy. The third strategy is regular screening. Women should undergo pap smear testing to detect any abnormal cell like koilocyte, and also consider HPV co-testing to check for the presence of high-risk HPV DNA. By following these prevention steps, we can significantly lower the risk of HPV infection and the potential development of cervical cancer.
In conclusion, koilocytosis is caused by HPV. The virus makes protein that stop the master control. This leads to large irregular nuclei and a clear halo around them. These changes show how the virus damages the cell and help us to detect HPV infection early.